We have been asked what protocols our hospitals are following for the safety of patients and employees during the COVID-19 pandemic and why. At the beginning of the pandemic, the Centers for Disease Control and Prevention recommended that hospitals give priority to urgent visits and delay elective care to minimize the spread of COVID-19 in hospitals. As a result of the pandemic, many important and needed medical services and procedures were not done. As the pandemic continues, the CDC has urged hospitals to provide necessary services while minimizing risk to patients and medical personnel, and while also considering the level of COVID-19 in their communities. Hospitals are urged to stay in contact with state and local health officials during the COVID-19 pandemic regarding COVID-19 rates and surges. Among safety protocols suggested by the CDC regarding treatment during the pandemic are to ensure adequate staffing and bed capacity, availability of PPE and other supplies, to be prepared to rapidly detect and respond to a spike of COVID-19 cases, to monitor trends in case counts and deaths, especially for high-risk populations, to optimize healthcare services when available and appropriate, to follow CDC recommended guidelines regarding infection control practices, to prioritize services that, if deferred, are most likely to result in patient harm, such as symptoms of stroke or heart attack, dental emergencies, acute abdominal pain, certain cancer treatments, and well-child visits for newborn, to prioritize at-risk populations who would benefit most from medical services, such as those with underlying health conditions, those most at risk for complications from delayed treatment, and those without access to telehealth services. Each individual hospital has its own protocols, rules, and guidelines. The differences that patients will see might include things such as the use of mobile device check-in and reduced on-site paperwork. A COVID-19 test might be administered to those who are admitted to a hospital or who are scheduled for surgery or a procedure that requires general anesthesia. Exam rooms and radiology equipment are being thoroughly cleaned after each patient, and hospital visitation and accompanying of patients to appointments is being restricted in most cases. Make sure to check with your hospital or provider's office before going to see what their current policy is. The Connecticut Center for Patient Safety urges you, if you have a patient who needs to have somebody accompanying them and they are not being permitted, to speak with an individual at the facility to see if an exception can be made. The Connecticut Hospital Association has a complete list of the state's hospitals with informative links, and it can be found at https://cthouseasp.org/covid-19-update-center/hospital-covid-19-resources. Click on the link to your hospital to find the latest on safety protocols regarding treatment during the pandemic. As COVID-19 cases are increasing, restrictions are quickly changing. For the most relevant regulations where you live, visit portal.ct.gov/coronavirus. To learn more, visit www.ctcps.org.